Yeah, I would like to invite Miss Sulosana to present the paper.
Thank you for inviting me. First, and unit of Siddha Medicine, University of Jaffna. And my supervisors, Dr. Mrs. T. Dayalini, Head Unit of Siddha Medicine, University of Jaffna, and Dr. Mrs. Pancharajah, Unit of Siddha, Senior Lecturer, Unit of Siddha Medicine. Yeah. And my heading is Moothirakirichchara noi. It means urinary tract infection in Siddha. It's a literature review. So in my introduction part, this in indigenous medicine of Sri Lanka consists of Ayurveda, Siddha, and United medicine. So in Siddha medical system is popular in northern part of Sri Lanka, mostly practiced by Tamil people. Siddha medical system from Lord Shiva to Siddhas. So the Siddhas divided the diseases into 4,448. So this Moothirakirichchara is one of the disease mentioned under this 4,448 disease in Siddha literatures. This Moothirakirichchara means a sottu mutram. Sottu means it's a dripping dysuria with painful micturations. Painful micturations means dysuria. So this urine nowadays the urinary problem is more common in all of the Sri Lanka, mostly in Jaffna as well. So poor intake of water, diet, gut problems, and diabetes are the causes for the Moothirakirichchara. And synonyms, types, causes, common sign and symptoms are different from literature to literature. This because of this one, the synonyms in terms of Moothirakirichchara mentioned in all Siddha literatures. So in my material and methods, the Siddha literatures were searched from the Library of Unit of Siddha Medicine, University of Jaffna, and from the Vidyanandan Library, University of Jaffna. The 8 books were identified and collected for this study. Data was collected, listed out, and tabulated. These tabulated data were analyzed. So these are the 8 books which mentioned about Sindhamani, Siddhamadal, Noymadal Nadal Therapy, and Sittararvai Marthuvam, Jeeva Rakshamildam, Dhanvandriya Vaityam, and Sicharatna Deebam, and Ahasthiya Gunavahadam. So in my results, first we want to discuss about the synonyms. The 5 names were identified in 8 books. In all the books, they mentioned about the Moothirakirichchara. The names also were found in 2 or 3 books. And second thing about the definition, out of 8 books taken for this research, only 5 books mentioned about the definition of Moothirakirichchara. So Mootra means urine and Kirichchara means a small amount. So the Moothirakirichchara means small amount of urine passed with pain in abdomen and in urinary tract. So all the definitions were similar, which were mentioned in all the 5 books. And next, the type of Moothirakirichcharam. So 12 types of Moothirakirichcharams were mentioned in 7 books. One book didn't mention about this type. So the Vata, Pitta, Kapha. These 3 are the more in Siddha medicine, that these 3 are mentioned as 3 doshas. According to these 3 doshas, all the classifications made further. So this in all these 7 books mentioned about the Vata, type of Vata, Pitta, Kapha, and Thonda. Thonda means 2 doshas with. Dosha means all in same category, and the other types only mentioned in 1 books. Next thing, causes of Moothirakirichchara. Out of 8 books, 7 books were mentioned about the causes of this disease. So out of these 7 books, 31 causes were identified, and mostly the urinary calculi, urinary with the muscular blocks, etc., and avoid passing urine and sperm, increased body heat, impurity of water, and sexual contacts. It means that the infection spread from the sexual contacts. These are the causes mentioned in mostly mentioned in the those books. So the next thing is common sign and symptoms. So in Pancharajah, I want to tell about that book because this is the purely Siddha book, which from King Pancharajah from Jaffna. So in this book, this verse mentioned about the sign and symptoms of the Moothirakirichchara. So about this, out of 8 books, 7 books mentioned about the common symptoms, signs and symptoms. In 36 common signs and symptoms were identified from these 7 books. Most commonly, burning sensation while urination, oliguria, and the color of urine will be red or dark yellow. The fever, discharge, and pain in kidney. This pain in kidney means in the causes I mentioned about the urinary calculi also cause this urinary tract infection. If that is the cause, that the pain in the kidney will appear. So the next thing is sign, and I mentioned earlier that mostly mentioned types of the Moothirakirichchara. So in this Vata Moothirakirichchara, lower abdominal pain, oliguria, pain in penis, swelling in penis, unable to subdue pain, and these are the more common symptoms mentioned under the Vata Moothirakirichchara. And this is the Pitta Moothirakirichchara. So in the Vata, mainly the pain is the main sign and symptom, and in Pitta, the significant symptom. So the body heat, bloody urea, pin and needle pain, and these things will be appear as a sign and symptoms in Pitta Moothirakirichchara. Then the next thing is Kapha Moothirakirichchara. So in this one, Kapha means a secretion So it will caused by mostly it's caused by the sexual diseases something. So it may be related with white discharge or sperm discharges or like that. It will relate with. So in my discussion part, of Moothirakirichchara were mentioned. It is caused by three doshas such as Vata, Pitta, and Kapha, as I told earlier. The main causes of imbalance of three doshas are the unhealthy food habits and the activities of day-to-day life. So it will also react. It will also play a major role in the disease condition. And the literature says these factors change the ratio of Vata, Pitta, and Kapha. And nowadays, the renal diseases are more common in Sri Lanka, especially in Jaffna due to the hard water. And Moothirakirichchara can lead the chronic kidney disease. That the Moothirakirichchara can be caused by the renal stone, and it will cause the chronic kidney diseases as well. So therefore, the knowledge of Moothirakirichchara is essential for us to diagnose and give proper treatment to the patients. See, the treaters mentioned about the Moothirakirichchara. So, synonyms, types, common in Siddha literatures. Most of the literatures, even though there are exceptions as well. So, in my conclusion, from the review, the causes, signs, and symptoms of Moothirakirichchara could be compared with urinary tract infection. The urinary tract infection is also caused by the, as I mentioned earlier, in the most of the created with urinary tract infection. In Siddha books, separate treatment has been given for all kinds of Moothirakirichchara. So the treatment given for Moothirakirichchara can be highlighted and taken for further studies, including lab analysis as well. And these are my references. And thank you.
Dr. Sulosana. Hello.
Yeah.
Dr. Vijita, you can make a comment for her.
Dr. Sulosana, the way you present the paper is appreciated. It's very nice presentation.
Thank you, madam.
You have mentioned the Moothirakirichchara could be compared with the urinary tract infection in the conclusion slide, but you did not speak anything about the urinary tract infection in the introduction part or in the discussion part also.
Okay.
If you mention both signs and symptoms, if you compare both signs and symptoms as a table, I think it's better.
Okay, madam.
Otherwise, mandatory topic selection, because in Siddha system of medicine, the literature research is essential because different authors mention different types of disease and different types of clinical features. Anyhow, in your research, you have mentioned the signs and symptoms and the signs and symptoms
Hello?
and types mentioned. Oh yeah, in your research you have mentioned the signs and symptoms and the type of disease are mentioned, even the definition also similarly mentioned in all the books.
Yeah. mostly mostly the similar symptoms are mentioned, but there are some exceptions also there. In
Okay, you
one
have
book.
mentioned those variations also. Okay,
Yeah.
okay, it's a nice presentation.
Thank you,
Okay.
madam.
Okay.